Welcome to another edition of Ask Dr. George. Today we're going to be talking about teeth in a day. That's a hot topic these days, so let's get to it.
All right, Dr. George, what is teeth in a day?
Well, teeth in a day is something that we do when people are about to lose all the rest of their teeth. And so this happens quite often for various reasons. You know, people may have had a lot of restorative work done in the past, they may have had a lot of decay, things broke down, and they're losing all their teeth. So in the past, as you know, with implants, it takes generally a number of months for the implants to take. So in traditional ways of doing things, what we did was we would extract the tooth, let the gums heal, and wait about 3 months. Then come back, place the implants, wait another 3 or 4 months, and then start making the teeth, which can take generally, another month or two to get the teeth made. So could be, a 6 to 9 month period of time where people didn't have teeth. Right. Where they would be wearing a denture, something like that, and people, would struggle with it. So teeth in a day is a concept that came up as implants evolved. We started understanding that we could start putting the teeth on right away at the same time, and then we could get rid of the dentures. And teeth in a day has evolved, and in my practice, I've come up with some different techniques that I use for doing teeth in a day that are very, very advanced now and eliminate some of the problems that we've had with teeth in a day in the past. And I'm going to share that with you today, what it is that I'm doing in my practice and how that's different than what is normally going on out there with teeth in a day. So let's take a look at a case here. So this lady here was about to lose the rest of her teeth.
Wow.
So you can see here she only had a few remaining teeth. The rest of these had broken off. And it's not that she didn't take care of her teeth. This lady had a lot of restorative dentistry done over the years. She had bridges, she had all kinds of things, but eventually they gave out on her.
Okay.
And now she doesn't have any teeth left, so we're going to have to remove the rest of these teeth. And so that's what we did. So we extracted her teeth and we placed implants. I'm not going to take you through the gory details of every part of the procedure, but basically what we did was we removed all of the teeth, placed all of the implants, and then I made for her a temporary bridge. Now the way that I do things is a little bit different than what happens out there, and I'm going to go into that in detail with you in a moment, but this is the lady right after we did the surgery.
Wow.
And so her teeth have been removed. This is her temporary bridge that she's wearing. You can still see that there's stitches still here. This is immediately after the surgery.
Now, what kind of pain would you expect from something like that? Would it be a lot of pain or something that you can work through?
Surprisingly, they have very little pain. The most that I prescribe is ibuprofen.
Okay.
I don't even put them on Tylenol 3s or any kind of narcotics. And most people are fine. They don't have a lot of discomfort. This bridge now they're going to be in for about 3 months, and then we're going to go to making the final bridge. And this is what we did for this lady, and I'll just show you here how everything turned out. So this is the final prosthetic, and this is a porcelain bridge that she has here. Now, a couple of things that I want you to notice about this.
Okay.
So the first thing is that my bridge is just teeth only. These are her own natural gums here.
Oh, right.
Okay.
Which is important.
Yeah, which is really nice. Now, that has its pros and its cons, okay? Because if you look at the way that gums drape around teeth, okay, we are kind of mimicking this here. But it's not perfect, and this lady doesn't show it. Her lip line comes to about here. So when she smiles, you don't see that gum line. But this is a very, very nice result. It looks, it turned out to be a really excellent result. And this is kind of what we're looking for when we're doing teeth in a day. So at no point in time did this lady have to wear a denture. She never had any removable teeth. The day that we removed her teeth, she had a prosthesis like this inserted, and she was able to go on with her life and be able to function and smile and talk with confidence.
Absolutely.
And that's what this is, really all about.
Well, it's certainly a great result here for 3 months and her confidence was probably through the roof when she left your office with
Yeah.
teeth in a day.
Yeah.
That's amazing.
Yeah. So what I want to do right now is I want to discuss with you sort of how teeth in a day is done, how it's done traditionally, who's doing it, and how they do it. So understand a couple things. I've talked about it in other videos, and that is that the traditional way of doing teeth in a day is done with an immediate temporary denture. Okay? And as I've described in the past, so what a denture is, it's a bunch of individual plastic teeth that are embedded in a pink plastic resin that simulates your gums. Okay? And so what you cannot do with a denture is you cannot just have a set of teeth. Like you can't do this. Okay? Because with a denture, all of these teeth are individual teeth, and the only thing holding them together is this pink plastic. Okay? So the biggest difference in what I'm doing and what everybody else is doing is that what everybody else does is they, in order to make the temporary teeth, they first fabricate a denture.
Okay.
And then what they do is on the day of the surgery, they insert that denture, they glue it down to posts that are attached to the implants, and then what they do is they remove the denture from the mouth and cut off all the extra pieces of that denture and turn it into a temporary bridge.
Okay.
So what I want you to notice here is that in order to have the denture, we have to have this pink base. Okay?
Mm-hmm.
So let's for a moment take a look at this situation here. So let's say this is you, the patient, and this is you with your teeth. Okay? Let's pretend these are still your teeth. We need to remove these.
Okay.
So this is where the edge of your teeth needs to be when you smile, right? So that you can picture if I was smiling here that I would have my teeth right here, right?
Mm-hmm.
And so imagine I pull out these teeth. Do I have room for a denture?
Right.
Are you following me?
Yes.
So as soon as I insert this denture, what's happened now is that I've dropped the edge of these teeth down, a centimeter lower than where they were before.
Uh-huh.
So now what you would see here is you'd see all this pink plastic, and then you'd see teeth. Okay? So obviously that's not going to look very aesthetic.
Not cosmetically awesome.
Right? Can you get all that, Connor? Perfect. So what's going to happen then is that in order for them to use a fixed temporary denture on you, they have to make room for that denture.
Okay.
So this is Teeth in a Day's dirty little secret that they don't talk to you about, but this is what's happening when you have teeth in a day. They're then going to cut back this amount of gum and bone to make room so that we can get your teeth up to the proper height.
Right.
So what they do is they take out all the teeth, and then they cut away another 1/2 centimeter of bone, and then they can fit the denture in there, and it'll look okay.
Right.
All right? Now, what that means is that we're removing a lot of bone, and I'm not a fan of that. I've never been a fan of cutting away all that bone.
Right.
I spend a lot of my time dealing with single teeth and small bridges where we're trying to regrow the bone so that we can have a nice result.
Mm-hmm.
So most teeth in a day look something like this. Okay? So we've got the teeth, we've got the pink plastic, and what they've done is they've cut away the bone from here to be able to put this pink plastic device in. Okay?
Yeah.
And what you can get, if you take a look at the way that this looks, it actually looks pretty good.
Yeah, it does.
Right? Because you can actually have the gums looking kind of perfect because we've made them out of plastic.
Uh-huh.
Okay? And so this kind of looks very nice, but the problem with this is that it becomes very difficult to keep clean.
Oh, okay.
Okay? So imagine that instead of having just teeth, we have the denture, and the line is way up here, and you're trying to get up here to get underneath of it and keep it clean.
Uh-huh.
And especially on the inside, if you can zoom in here, Connor, I don't know if you can see this, there would be this like ridge or this ledge on the inside here that will trap food up underneath of it, and it can be difficult to keep clean.
Right.
So that is one of the issues with teeth in a day, is that it's a little bit hard to keep clean up underneath it there. Compare that to something like this. There is no ridge. There's nothing there. It's just teeth. All you have to do is brush your teeth with this, and that's really all you need to do.
And your own bone and gum,
Yes.
which is important.
Yeah. Right. So this is how teeth in a day is being done by everybody. They cut away that bone, and they've actually come up with computerized, stents and guides for how much bone to cut away. They do it very precise. The surgery's done well, but I'm not a fan of cutting away all that bone if we don't need to.
Right.
Okay? And so these are situations where if somebody comes to me and they have teeth and I'm removing their teeth and they have gums, I want to preserve that gum tissue, and I want them to end up with something that looks like this. Okay? Just a bridge, just teeth.
Yep.
That's all we want. Okay? I don't want them to end up in something like this if they don't need to.
Right.
Okay? Now, that's not to say that we don't make teeth like this.
Okay.
Okay? Sometimes we have to, because the person is coming to me, they've already been missing their teeth, they've been wearing dentures for 20 years, they've already lost that bone naturally, and now I still have to get the teeth into the right position. So we might make a prosthetic like that for them, and if they want their teeth to be screwed down and not removable, they're going to end up in something like this.
Right.
But I'm not going to take them from something like this and put them into something like this if I don't have
right.
to. Okay? And that's the big difference between what I'm doing. Now, why is it that I'm able to do this and hardly anybody else can do this? The reason is because we're using some very specialized techniques, and these teeth are not dentures.
No? What?
No, what this is this is made by CAD/CAM milling.
Oh.
And so these teeth here are milled out of a solid block of acrylic.
Okay.
And that's why they're all joined together. They're not individual teeth that we've glued together. This is all one piece that's been shaped into a bridge.
Okay.
Okay, and this is what we use for a temporary bridge. And then we go to the porcelain bridge at the end. So this one that you're seeing here on the photographs, this is a porcelain bridge. And so, you have to ask yourself, what would you rather have somebody do? Remove your teeth, cut away a 1/2 centimeter of your jawbone, and then insert something that looks like this? Or do you want to just have your teeth removed and have a bridge inserted that looks like this, that does not have any of that pink on it if we don't need it?
I think I know what we're all going to choose.
Yes. So anyways, that's teeth in a day in a nutshell. That's what I'm doing, and I think it's a superior result to doing it with dentures. So that's what we've been up to here, and I'm really happy to say that this is something that I can offer to my patients here. So if you need to do teeth in a day, come and see me and we can talk about it. And I think that you'll find that what I'm doing here is a little bit different and innovative, and my price point is very good because I've also come up with some techniques that eliminate about 6 hours worth of work that I was doing to make the final teeth.
Awesome.
So we're able to, offer people porcelain bridges on more implants, no cutting away of the bone, at prices that are comparable or less than what other people are paying to have the traditional technique done with dentures.
Very good.
So that's what we've been doing.
Dr. G, he's your guy for teeth in a day.
All right, thank you. Thanks for listening.